I've been treating MS patients for 41 years as of July 2013. The infusion center as we know it today has not been a part of Riverhills from day one. The infusion center came about because of drugs that are now given intravenously in a vein over an hour period of time. Formerly, our drugs were all injectable into the muscle, and when the infusion of drugs became imperative for the treatment of patients, the infusion center came about.
We use infusions to treat various conditions, and those patients have all been seen and evaluated by a comprehensive team, including physicians and usually nurses as well. There's been a history and a physical and testing that's done to verify diagnoses and then come up with a specific treatment plan.
You can't help but smile when you're here, you know. All the staff makes the caregivers feel very welcome.
Patients that benefit from infusion therapy are typically our MS patients that have an acute attack or an exacerbation of their disease. They come in for steroids. Those that have chronic disease and need to be infused with Tysabri, which is a monthly infusion for disease-modifying therapy.
The patients that can benefit from infusion therapy are two main groups. One of them is the MS patient who requires Tysabri infusions, and the other is headache patients or other pain patients who require infusions.
I think what sets Riverhills apart is that we have the ability to do many things for you during one visit. You can see your neurologist, you can have your MRI scan, you can have an EEG or a visual evoked potential, you can get your IV infusion that day. So there are many services that we can incorporate into one visit here, and I think that that's unique.
I was diagnosed with multiple sclerosis 30 years ago, and I've been a patient with Dr. Reed for 8 years. It's definitely one-stop shopping. It's parking, it's convenience, it's camaraderie, it's neurologists, it's if you're having a good day, they help you have a great day. If you're having a down day, they turn and frown upside down. So it's just a very good experience, whether you're getting an MRI, whatever you need done, this is a place for it.
It's kind of a one-stop shop. My doctor's here. They have a super staff, and like I say, everything right in the same building here. It's really handy for me.
I think the advantage of having the infusion suite at the office site is that we all can kind of monitor, walk in and out, answer the questions of not only the nurses that are infusing the drug, but also the patients. And of course, if there are reactions and complications, we are right there. I think the most important thing for patients coming into the infusion suite is to know that you are cared for by caring, competent people.
The staff here has been great. They stay on top of everything I need as far as blood work, MRIs, scheduling my appointments with Dr. Reed, who's my neurologist, so I don't have to keep track of anything. They make sure that I get what I need when I need it.
When patients come in for a visit, we do a preliminary checklist to make sure that they are safe and it is okay to administer medication. We also follow up with their lab work and their MRIs to make sure that they are compliant and are able to receive medication.
They're actually extremely helpful in managing the MS patients. They know a lot about MS, so they're able to pick up on stuff that otherwise would get past.
Basically, I tell the patients, don't stress, let me stress for you. Stress is bad for multiple sclerosis. So if I can help them alleviate their stress, that's huge.
How they treat you as an individual, very friendly. They don't talk down to you. They don't talk about your disease as a weakness. They talk about your strength and how you look good and feel good. They treat you like a family member.
My insurance has changed twice in the 4 years that I've been coming here, and it's never been a problem. The staff here has been great as far as calling my insurance company, checking with the drug manufacturers and seeing what copay programs they might offer. It's been wonderful. It's been very easy.
Infusion therapy has helped Barry manage his disease by giving him encouragement. He is more relaxed. He's not as worried. He sees other people in the same situation.
The infusion therapy for me has been incredible. The infusion I've been on has totally done wonders for me. I'm working, I drive, I lead my life as I always have. It's been incredible.